Year 2014 and the beginning of 2015 have been exceptional years for telemedicine. There have been a complete revolution in technology in healthcare in the last few months, in the last year and a half. So you are seeing new sensors, new devices, you're seeing computing power at the end, in the periphery, in the devices, and you are seeing a whole explosion of new devices to measure all kinds of vital signs and parameters that are being invented. There's a tremendous amount of innovation in this industry. There's a tremendous amount of investment in this industry. So the global scenario for telemedicine has completely changed in the last year, year and a half. So I think one of the key things here also is the acceptance of this technology by the US healthcare system. So specifically, previously you were not able to get insurance coverage for services, medical services delivered over telemedicine, and this has changed. Now for chronic care diseases, Medicare actually compensates doctors for doing telemedicine consultation. And this is an extraordinary advancement because this now allows so many chronic care patients to access this service. So this whole sector is exploding in the US and in Europe right now. Not only to provide, I think, new advances in terms of devices, but also in terms of reaching people that don't have access to experts. So if you go to the Midwest or to other areas in the US where there is harder for some experts to reach people, this technology now makes it possible for everybody to access experts in their home. India is also, I think, beginning to catch up with this revolution, right? It's a little slow because we have some unique challenges of our own. One of our challenges is a lack of bandwidth, for instance, right? So telemedicine requires bandwidth because you're going to have a video consultation. And in our country, because of bandwidth issues, this is causing us to take off to a slightly slow start. But the government has now announced, I think, a fiber project to lay fiber to just about every village in India. So high-speed bandwidth will be available shortly. So this is something that I think we should all look forward to changing soon. So telemedicine in India so far has been limited to non-profit organizations trying to reach extremely far-flung places and trying to do some consultations with them. World Health Partners, the organization I work for, has been at the forefront of this. We have done about 100,000 video consultations in rural areas, contributing to reducing under 5 pneumonia, diarrhea, and to other healthcare services in rural areas, right? But it has not hit the mainstream. I think so. What's happened in India is this has not yet become something that the middle class accesses on a regular basis. That's because bandwidth and therefore the acceptability of the solution is not there. But as we see bandwidth go up, this is going to happen in India as well. So I think the future for telemedicine is extraordinarily bright. This is something that's going to happen in a very big way in India, and this is just going to follow the trend in the entire world. So World Health Partners is currently working in Uttar Pradesh and Bihar, where we work with local providers and make it possible for them to do a remote consultation service. So what happens is a patient walks into a local provider in a village in Bihar, so let's say in Saharsa, and then we take the vital signs. We have a telemedicine kit, and this kit has remote sensors. It has 5 sensors. It has a pulse oximeter, it has a stethoscope, it has an ECG, a blood pressure monitor, and a thermometer. These are all electronic sensors. So the patient comes in, the provider uses these sensors to take their readings. So these are vital sign readings that are taken, and then we start a video consultation. So the doctor in our facility in Delhi, so we have a whole bunch of doctors in Delhi and Patna. We can panel them, experts as well. So they sit there and they have a video consultation with this patient who is now in rural Bihar, in Saharsa. And they're able to see them, and they're able to have a conversation with them and understand more about their condition. They're able to focus the camera on specific body parts to see if there's any issue. So for instance, if a pregnant mother has come in for an antenatal care checkup, the camera is then focused on their feet to see if there is swelling, to see if there's an edema, to look at the general pallor of the patient, to generate a rapport with the patient so that you can talk more and understand about their condition. So we do this whole video consultation as well. So specifically under sponsorship by MSD for Mothers, we've done 52,000 ANC visits in Uttar Pradesh, right? So World Health Partners, and that's the specific MSD for Mothers, but under the Bill and Melinda Gates grant in Bihar, World Health Partners has done 100,000 consultations, which are of general morbidities as well. So the future for, and this is just the start. I think right now nonprofits are looking at it in a very in a way to reach populations that don't have access to healthcare. But telemedicine itself, the technology, looking at the trends in the West, is just going to become so mainstream pretty soon that I think it's coming to every home very, very soon. So the challenges in telemedicine in India, I think primarily it is bandwidth. That's the first one, because that's a technology challenge. To enable telemedicine, you need bandwidth, right? So without bandwidth, then you have to come up with innovative solutions to try to minimize bandwidth, which has been the subject of our Jugadathon and things like that recently. The other challenges are somewhat of a regulatory nature, right? Today, under the laws of India, a telemedicine consultation it's not quite entirely clear whether you're allowed to even do it. So if you have a telemedicine consultation, then the doctor is only allowed to prescribe a certain number of things. There are certain regulations around these telemedicine consultations. So I think some of these, taking a clue from the United States, which has now made, like I just spoke earlier, under Medicare, you can get compensated for telemedicine. The Indian government will also have to look at telemedicine as an emerging technology that challenges the state of our regulation today. And we will really have to change our regulations to adapt to this new and emerging technology so that we can make this technology available to all our people, resulting in better outcomes for everybody.